Ann Radke has it all: a loving family, a loyal pet, close friends, and a satisfying job.
I'm a receptionist at the hospital and work 5 days a week. I'm a very busy mom. I have 3 sons that keep me busy. I have 1 in college and 2 in high school. Both of them are very active in sports, so we're always running to those things.
She's also the executive chef of her own kitchen.
I have boys, so they eat a lot, so food is always a priority at our house.
Living in Holland, Michigan, Ann enjoys shopping and outdoor activities, but heavy menstrual periods often interfered.
Our family is big into camping and we love doing things outside, but camping is not something you can do when you have heavy menstrual cycles.
Ann told her doctor how her heavy periods interfered with her daily living, disrupting her sleep at night and making it hard to keep up with her job.
You're answering phones, you've got jobs to do, you're talking to people, and suddenly you're thinking, wait a minute, I've got to get to the restroom. You'd go through 16 tampons in a regular work day, and when you go to bed at night, you do feel like as though you're wearing a diaper because you've got to have so many pads on to just get through the night.
Her gynecologist diagnosed her with heavy menstrual bleeding, or HMB, and offered surgical and hormonal options.
There was the oblation, there was the hormonal contraceptives, and there was a hysterectomy. And after meeting with Dr. Bennett and going over all of my options, none of them were very attractive to me.
Then he mentioned a prescription medication, LYSTEDA, tranexamic acid tablets.
I was excited because it was not an invasive surgery, it was not hormonal, it was a drug that I could use for a very short amount of time, only during my periods.
Following her doctor's instructions, she took 2 tablets 3 times a day during the first 5 days of her cycle and was pleased by how well LYSTEDA worked.
When I took LYSTEDA, it was a noticeable difference in my periods being lighter and not as cumbersome. I thought it was really an amazing drug. It helped my situation immensely because I was actually able to leave the house. I didn't have to load up on sanitary protection. I wasn't always checking to make sure that I had enough tampons or pads with me. I was able to just do a job or be outside and not have to constantly look for a restroom. With LYSTEDA, my period is no longer the focus of my day.
LYSTEDA is a prescription medicine used to treat your heavy monthly period, menstruation, when your bleeding gets in the way of social, leisure, and physical activities. LYSTEDA does not contain any hormones and is taken only during your period. It does not treat premenstrual symptoms, does not affect your fertility, and cannot be used as birth control. It does not protect against sexually transmitted diseases. LYSTEDA has not been studied in adolescents younger than 18 years of age. You should not take LYSTEDA if you currently have or have ever had a blood clot, have been told you're at risk for having a blood clot, or are allergic to LYSTEDA or tranexamic acid. LYSTEDA can cause serious side effects, including the risk of serious blood clots may be increased when LYSTEDA is taken with hormonal contraceptives, especially if you're taking higher than your normal dose of birth control, are overweight, or if you smoke cigarettes. Risk of serious blood clots may also be increased if you take LYSTEDA with medicines used to help your blood clot, or some medicines used to treat leukemia. Be sure to tell your healthcare provider if you take any of these medicines. Stop taking LYSTEDA if you experience any eye changes, and promptly report any eye problems to your healthcare provider. If you have an allergic reaction, have shortness of breath, and your throat feels tight, stop taking LYSTEDA and get medical help right away. The most common side effects of LYSTEDA include headaches, sinus and nasal problems, back pain, pain in your abdomen, pain in your muscles or joints, anemia, and fatigue. If you notice a change in your usual bleeding pattern that worries you, or your heavy bleeding continues, contact your healthcare provider right away. This may be a sign of a more serious condition. You're encouraged to report side effects of prescription drugs. Contact Ferring at 1-888-FERRING or call 1-800-FDA-1088 or visit fda.gov/medwatch. Please see full prescribing information for LYSTEDA.